There's a new report that is showing America's population is getting older than ever. There's now a record high median age of 38.9. Compare that to 1980 when the median age was just 30. So what does this mean for the workforce? It's all about health, and Dr. Brian Cole is an orthopedic surgeon with Midwest Orthopedics at Rush and joining us this morning. Good morning to you, Dr. Cole.
Good morning, Sylvia. I'm hoping our connection stays strong here. You'll let me know if there's a problem,
Yes,
please.
I will. It looks like we're having a little bit of delay, but as long as we can hear you and see you partially, that's the most important thing. So as a doctor and an orthopedic surgeon, are you witnessing the result of this aging population? And if so, what are you seeing?
Yeah, I would say that as Americans are able to stay active longer and their bodies are attempting to hold up, there's no question that I'm seeing an increase or an influx of individuals coming into my office. I mean, take pickleball, for example. There's 50 million plus people that are enjoying pickleball on a regular basis. These tend to be older individuals, so we're seeing a litany of injuries that we necessarily didn't see before. So we're always balancing the benefits of exercise with the potential downside of injury and the time required for recovery.
Yeah, isn't it funny? Who thought pickleball could be something that would be sending people to their doctors for help? But as this population ages, is there anything in the works in the future, any research that's being done to try to help people stay as healthy as possible and learn how to make that happen?
You know, I think the first thing that we've learned is that the effects of injury, if people say, well, what do I have to do to stay healthy longer? Don't get injured. So that's the first one. And that's a really basic common sense thing, but that's the demise of any of us because it leads to obviously immediate inactivity. But I would say that we have a number or a litany of options now in terms of nutrition, understanding the benefits of weight-bearing exercise, the importance of maintaining body weight in terms of reducing load. For example, every pound that you and I carry above our knees is magnified 5 to 7 times depending on what we're doing. And patients who may have underlying indolent disease, osteoarthritis affects 55 million people in the United States. That's 1 in 4 people. And they generally get symptomatic when their activity levels go up. So maintaining an ideal body weight is just like reducing activities because it reduces load. Similarly, an anti-inflammatory diet, that's another one that leads to reduced inflammation. And even though you and I coexist with underlying arthritis, we may not see the symptoms of that if we maintain good health.
Yeah, everybody wants that magic bullet. I understand even an extra 10 pounds of weight can put damaging pressure on your knees. You're talking about more people trying to do things like pickleball at an older age. You're seeing more injuries. At what point do people need to realize, okay, I just don't have the body or I can't do the things that I used to do? What's your best advice?
I mean, I think some of these things are just self-determining. What happens as we age, it's interesting. There was a study that showed that you and I begin to feel old at the age of 42, right? So the things that at 41 or 39 that would not cause any symptoms, stiffness or discomfort, all of a sudden at the age of 42 on average, we start to feel things we didn't feel before. So I think my best advice is your body's going to tell you, but really maintaining a mix or a blend of activities that include weight-bearing exercises is probably one of the most important things. And engaging in some type of cardiovascular activity at least 3 times a week for 30 to 45 minutes a time, an episode, is one of those things that you have in your control to help you enjoy remaining active. And weight-bearing exercise frequency are 2 things that you can do to maybe prevent injury as you engage in things that may become more risky as we age and our soft tissues don't really adapt as well.
Okay, so pay attention to your body, make sure you eat healthy, and do all of the other important things to make sure you last in your body for as long as possible. Dr. Brian Cole with Midwest Orthopedics at Rush, thank you for joining me this morning. Good to have you on.
Thank you for having me. Have a wonderful weekend.
You too. We'll be right back.